Thank you for choosing Orthopaedic Associates of Muskegon and Mercy Health for your joint replacement. We are excited to partner with you on this journey. We know having a total joint replacement surgery can be overwhelming, and we are here to help. This video will provide you with information about what you can expect before, during, and after your surgery. The video is intended for viewing by both you and your coach. It is important that you watch this entire video and read everything in the binder that you receive from your surgeon's office. Please be sure to complete your patient commitment letter along with the coach's commitment letter and return it to our office. We have included a return envelope in your total joint binder for easy return. You will also be receiving a survey by email from us. It is very important that you complete these surveys we send to you prior to surgery, 3 months after surgery, and 1 year after surgery. These surveys allow us to know how we are doing and to help determine where we can make improvements in the surgery process.
Thank you for preparing for your surgery. If you haven't done so already, it's very important that you choose a coach. Your coach is your partner and will help you be successful in this journey. Your coach can be a family member, a spouse, or a friend, but it should be someone that you know well. Your plan will be to go home the first day after your surgery, and your coach will need to stay with you the first 2 or 3 nights after your discharge to make sure that you're safe at home. It's very rare that anyone goes to a nursing home after a total knee or total hip surgery anymore, so having someone stay with you the first few days after the surgery will ensure that you have the help that you need. You will also need your coach to drive you to some appointments. If they are unavailable, please make arrangements for rides once you get home. You won't be able to drive for at least the first 2 to 3 weeks after your surgery, and you're going to need rides to doctor's appointments, therapy, and potentially lab draws. You also may need some trips to the grocery store for some things that you need at home. The other thing your coach can do for you is help you with paperwork. If you don't need any help with that, that's great. But if you need help with FMLA paperwork or disability paperwork or verifying your insurance, make sure your coach is someone who can help you with that. You will need to prepare your home ahead of time to ensure safety. For example, be sure to go grocery shopping and cook and freeze meals ahead of time. Also, you can arrange with family members or friends to bring you meals. If you are a caregiver for someone, then make plans for child care, elder care, or pet care as needed. Also, prepare your house so that you can get around safely. For example, you need to be able to accommodate getting into your bathroom with a walker. If you have any cords or throw rugs that are in your way, you want to get them out of the way. You don't want to trip over anything. If you need to reach certain things in those first few weeks, then put them in a place where you can reach them. So if they're on a high shelf, move them down to where you can get to them. If they're low in a closet, get them out, also where you can get to them. Also, if you have things that need help around the house, such as lawn care or snow removal or laundry or household chores, make sure you arrange for that help prior to your surgery. If you plan ahead of time, this whole experience will be better for you.
Not only do you need to prepare your home for surgery, you need to start preparing yourself. There are several steps that you can take that can have a large impact on the outcome of your surgery. Stop smoking. Smoking tobacco, e-cigarettes, and even vaping can all delay healing due to the nicotine levels. Eat a healthy, iron-rich diet. Your binder has a nutrition section that gives you sample diets that help improve healing. Properly manage your diabetes. When your blood sugar is high, your body doesn't heal as quickly. Your surgery may actually be canceled or delayed if your hemoglobin A1C is over 8. Gradually decrease your pain medicine. This will help the medications we give you after surgery work to control your pain. Begin exercises that are outlined in your joint binder. The stronger you are before surgery, the easier your recovery will be. And make sure you schedule and attend any required preoperative appointments. Those may include a visit to your family doctor. Your doctor may want to see you before surgery to address any medical needs. A visit to your dentist. While you shouldn't have any non-critical dental work done within the month before surgery, regular cleaning can help decrease your risk of infection. If you have heart problems, you may be required to visit a cardiologist and get an EKG or potentially even a stress test. Everyone will be required to have blood drawn prior to surgery. Your surgeon may have you stop certain medications prior to surgery to assist in the prevention of blood loss and also infection. please look at your joint binder for the complete list of medications and supplements that you need to stop prior to surgery. There are times when your doctor will want you to continue to take an important medication, but please make sure you have discussed all of your medications and supplements with your doctor. Most importantly, success starts with a positive attitude. You will need a set of goals for yourself. A successful surgical result will require hard work from you during your recovery. It's important to focus on what you can control. You will have pain following surgery, but we will do everything we can to make your pain tolerable. To keep your pain tolerable, you may want to use several different tools such as ice, positioning, walking, and pain medicine. The goal is not to be pain-free, but we want you to be in a place where your pain is manageable.
You will be provided with surgical wipes prior to surgery. It is very important to follow instructions regarding the skin cleansing that needs to be done prior to surgery. If you have questions, please call our office. You will receive 1 or 2 phone calls from our pre-op department. These calls will review your medical history, your current medications, and what medications to stop taking and when. Please note that we will ask you on several occasions what medications you are taking throughout the surgical process. This is because it is important to review these medications on several occasions so nothing gets missed, or in case there have been changes. This phone call will let you know the time of surgery and when you should arrive at the hospital. They will also let you know when you need to stop eating and drinking. The day before surgery is an important day. Make sure your home preparations are completed. This also includes washing your sheets and towels so they are clean when you return home. This will help reduce the chance of infection. Do not let your animals get on your clean sheets or sleep in your bed while you are healing, as they too can increase the risk of infection. Make sure you are packed for your hospital stay. There are several items to bring to the hospital. Your total joint binder is important so that we can keep all of your important education in one place. Be sure to pack comfortable clothes and supportive shoes. You will be able to wear your comfortable clothes while you're in the hospital if you would like. And supportive shoes will help you as you walk with physical therapy. Please do not bring sandals, slippers, or flip-flops, as these can increase the chance of falling. If you have your walker, please bring it with you. Your walker will be needed during your hospital stay, as you will need this to work with physical therapy. By bringing it with you, we can make sure that the walker works well and is sized to you appropriately. Bring a cell phone charger if you plan to use a cell phone in the hospital. Your family can leave these items in the car until your surgery is complete and you are in your hospital room. Remember to bring a list of your current medications in with you at the time of surgery and to leave all valuables at home.
The day of surgery, you will check in at registration at the scheduled time we give you to arrive. We will bring you back to a room to get ready for surgery. Here you will meet with the anesthesiologist and your surgeon. An IV will be started and you will receive a nasal swab of betadine for infection prevention prior to going to the operating room. Once we have you prepped for surgery, a limited amount of family can stay with you until you go to surgery. Your family will be able to wait in the waiting room near registration until your surgery is complete. When you wake up from surgery, you will be in the recovery room, also referred to as PACU, for at least an hour. In PACU, the nurses will frequently check your vitals. You will be wearing oxygen. You will have compression devices on your legs to help prevent blood clots and maintain circulation. We will make sure that your pain is tolerable. Your family will be able to see you once you are in your room. You have a large care team, and they will be in and out of your room frequently throughout your stay. You can reference your joint binder for description of who is included in your team. Pain management is important to us during your hospital stay. The expectations for pain control are, even though you may have had a nerve block, you will still have pain after surgery. Our goal is to make sure your pain level is tolerable and that you are not too sedated. Moving will help to decrease pain. You will get up within 6 hours of surgery to walk. This is very important as we don't want your joints to get painful from lying in bed too long. If you walk short distances frequently, your pain will be better controlled. Please make sure to use your call light to ask for help when you need to get out of bed. Your first week after surgery will be the most painful. Make sure to try to take oral pain medications about 40 minutes prior to physical therapy. Cold therapy is a great way to reduce the swelling from surgery. Swelling is often one of the biggest causes of pain, and by icing frequently, you may be able to reduce your pain. Positioning will also help with pain control. Talk to the staff if you are uncomfortable, as we may have a way to reposition you for better comfort. Take frequent short walks and gradually increase the distance each time. Be sure to listen to your body and don't overdo it. And remember, you have to get back to where you started from.
You will be getting up and out of bed the day of surgery using a walker. Therapy will focus on teaching you safe movement. They will show you how to get in and out of bed, walk safely with the walker, and go up and down stairs. They will also teach you how to get in and out of a chair and on and off a toilet. You have a big role in preventing complications. Please follow through on what is required of you. To prevent breathing problems, you will be asked to perform deep breathing. You will be provided an incentive spirometer, and you will need to use this for the first 2 weeks after surgery to prevent pneumonia. You will also need to sit up in a chair. This will help build endurance and work to expand your lungs to improve breathing. You need to sit up in a chair for all of your meals. To prevent blood clots, you need to do ankle pumps continually and wear compression wraps on your legs. To prevent constipation, you will be given stool softeners. When you're not as active as normal and taking pain medications, it is easy to become constipated. Moving and drinking water will both help prevent this from happening.
Most of our incisions now have a mesh dressing, and it stays on until we see you back in the office for your follow-up appointment. This dressing will help your incision heal better. You may shower the day after your surgery, but it is important not to scrub your incision or immerse it underwater until your surgeon tells you it is healed. Please be sure to keep animals away from your incision. We know that your pets are family, but while you are healing, it is important that your pets do not sleep with you or that your incision is covered if they are lying by you. Many times your pet can sense that you're not feeling well and they want to be close to you, but this could risk injury or possible infection if they were to jump on your surgical area. Always use a fresh, clean towel and washcloth while you are healing. Please be sure not to touch your incision or allow anyone else to touch your incision. And be sure to wash your hands frequently and use hand sanitizer often. When you are discharged, we will give you a short-term prescription for pain medications. Your surgeon will include you in the plan for weaning off of these medications. It is important to take your medication as prescribed during the first few days after surgery to stay ahead of the pain. It is very hard to get pain control if the pain gets too high. You will also receive instructions on what medications you can resume after your surgery.
We appreciate you taking the time to watch this important video. It's important that you follow the instructions both in this video and in your binder. We promise to do our best to have a positive outcome for your surgery. The rest is up to you. Your dedication to the instructions and exercises will help make your surgery successful. I would like to thank you again for choosing Orthopaedic Associates of Muskegon and Mercy Health. Together, we are here to meet all your needs. As always, we want to continue to be your healthcare partner for life.